الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله.
Qabayan Radio 94.3, loud and proud.
Mga kababayan,
Qabayan Radio 94.3.
Qabayan Radio 94.3 FM remains dedicated
to delivering a diverse range of music and entertainment.
along with up-to-date news and reliable information
Our dedication extends to offering public services
and nurturing collaborations between the public and private sectors.
Connecting with the local
Filipino
and international communities.
proudly standing as the first
and only Filipino radio station in Qatar.
This is
Qabayan Radio 94.3 FM. It's back! It's back! LG and Jumbo's mega promotion!
LG and Jumbo's mega promotion.
Assured gift vouchers on every purchase of LG appliances, ACS, gaming monitors, TVs, and audio products. 0% installments, extended warranty, Mocafa loyalty points, no Joom, Air Miles, and Avios. Visit today at LG brand shops, Jumbo Store, and JumboSouk.com. Hurry! Offer valid till 16th of October.
Visit Aussie Grill Qatar. Enjoy our signature burgers, party box, and hand-breaded chicken buckets. Aussie Grill, adventure in every bite.
Blue Salon's big sale is back on. Shop for your high-end products at up to 50% off this October. And that's not all. Use code BSALE24QB at checkout for an extra 5% off your purchase. Don't miss out on this unbeatable savings from October 1st until the 30th. Shop now.
Craving mouth-watering seafood? Head to the Nat Al Bahar Fish Barbecue for the tastiest catch in town. Swing by Old Souk Wakra or Souk Wakif Doha for the freshest seafood, cooked just how you like it.
It's back! It's back! LG and Jumbo's mega promotion!
LG and Jumbo's mega promotion.
Assured gift vouchers on every purchase of LG appliances, ACS, gaming monitors, TVs, and audio products. 0% installments, extended warranty, Mocafa loyalty points, no Joom, Air Miles, and Avios. Visit today at LG brand shops, Jumbo Store, and JumboSouk.com. Hurry! Offer valid till 16th of October. Tuned in to the number one
Filipino radio station in town.
All right, gotta keep moving.
Qabayan Radio 94.3. 94.3. We're bringing you the best information. And non-stop entertainment.
Too late to turn back now.
So keep it locked right here.
Usapang Kabayan! Usapang Kabayan! Bibigyang linaw ang mga usaping nagbibigay ng interes sa mga kababayan. Sasagutin ang mga katanungan tungkol sa mga isyong may kinalaman sa mga overseas Filipinos. Magbibigay ng mga impormasyon at kaalaman para sa mga mamamayan. Ito ang Usapang Kabayan! Usapang Kabayan! Sabayang mapapakinggan sa radyo at mapapanood live online. Dito lang sa Qabayan Radio 94.3 FM.
Magandang gabi mga kabayan. Welcome to another special episode of Usapang Kabayan. I'm your host, RJ Tasha, and today we have something truly special lined up for you. Alam naman natin, as Filipinos, we shine wherever we go. And today's guests are no exception. A total of 13 Filipinos based in Qatar recently received the recognition of Top Healthcare Professionals in the Middle East Awards 2024. These medical professionals and active members of our community were given this recognition for their significant contributions to sustainable progress in the region's healthcare sector and their roles in enhancing the Philippines' reputation in the Middle East. Tonight, we are privileged to be joined by 7 of these esteemed individuals coming from various medical fields. Now, our show tonight is divided into 2 parts. The first part, I will be speaking with these 4 individuals next to me, who I am beyond excited to properly introduce to you. And the second part of the show, I will be joined by practicing dietitian and nutritionist, Ms. Carla Padrilanan, and from the field of dentistry, Dr. Rosana Millar Barrera and Dr. Christian Marvin de la Cruz. Now, all of our guests tonight are medical practitioners and healthcare professionals who don't just excel in their professions, but also they serve as role models for our entire community. So whether you're a healthcare worker or an aspiring doctor or just someone who wants to know how to stay healthy, you don't want to miss a minute of this episode of Usapang Kabayan. Now, it's my privilege to introduce the individuals next to me. So, hello. Sir Mel De Torres, who is a medical technologist, founding and current president of the Philippine Association of Medical Technologists Qatar Chapter, supervisor of point-of-care phlebotomy and accessioning department of pathology at Cedar Medicine, 23 years of experience in the Middle East, and he's a passionate advocate for point-of-care testing improvements and a consultant and speaker for professional forums in the Philippines and Qatar, so he travels a lot to be a resource speaker, so that's very nice. So thank you for joining us tonight. And I'm also proud to introduce Mr. Sirio Caras. And he is the chairman of the Philippine Professional Organization in Qatar in 2020. He's led several leadership roles and is the current advisor for the Philippine Nurses Association Qatar chapter. He's had 29 years of healthcare experience in the Middle East and is instrumental in organizing medical missions, blood donations, and continuing professional development activities for nurses. He's also the charge nurse at the Hamad International Airport's North Node Clinic Ambulance Service under Hamad Medical Corporation. Welcome. Great to have you here today. And Dr. Jane Cecil Cadag, former president of the Integrated Philippine Association of Optometrists, this year's recipient of the Honored Distinction Award by the Philippines Federation of Professional Associations for her participation in the global community and the field of optometry. She's also an advocate for healthcare awareness and involved in various community service projects, particularly with the Philippine Professional Organization, PPOQ, from 2019 till the present. And she's an optometrist at East Optics, holding a valid Qatar medical license since 2007. So you're the OG here. We came at the same time, 2007 as well. Thank you, Dr. Jane. It's a pleasure to have you with us today. And Dr. Diane Christine Bonsol, physician, educator, and community leader. She's a fellow of the Philippine College of Physicians, diplomat of internal medicine, and a member of the Institute of Functional Medicine and American Diabetes Association. She's an esteemed consultant in internal internal medicine and a practitioner of functional medicine in the DOC Medical Center. She's had 13 years in medical practice, 5 years serving the healthcare community here in Qatar. And she is recognized for her significant contributions in the field and published research on diabetes and metabolism, which is a very relevant topic, which I feel like a lot of our Qabayans would love to hear about. So we have quite the credentials here this evening. So we'll do our best to tackle as much. And of course, if you have questions for those who are watching, you can also write in your comments and participate with us in this evening show of Usapang Qabayan. So for all of you, feel free to answer. How does it feel to be recognized as the top healthcare professionals here in the Middle East?
Well, for me, it's such a great honor and privilege to be awarded and to be selected as one among the peers, of course. I cannot really explain how it really feels, but it brings so much pride, actually, to all the Filipinos, especially the medical technologists working here in the Middle East.
Sa part ko naman, no, since, as you mentioned, RJ Tash, that I was also awarded in the Philippines from that event. Iba talaga ang feeling pagka nasa ibang bansa ka, like the Middle East itself, the whole Middle East, kasi they were announcing that 600 nominations, we are shortlisted as 129 awardees. So talagang very happy, overwhelming in everything. Iba ang feeling na iiyak-iyak ka pa.
Magandang gabi po sa lahat. For me, actually, I'm very thankful talaga, especially to Chairman Marvin for nominating me. Kasi ang sa akin lang RJ, ang service, I don't know that somebody appreciate my work, appreciate my service. That's all I can say.
So my experience with this awarding, it's deeply gratifying. It's a reflection of the hard work of everybody from the different field in healthcare, and the journey that we experienced from the start up to this day. So we are immensely blessed, and this is a chance for us, the Filipino community, to elevate the standards of healthcare that we can provide to the whole world. So we appreciate everything, the awarding organization. So thank you, and of course, congratulations again. We share this with all other 13 awardees from Qatar.
Okay lang po ba if you share mga memorable moments po about the awarding ceremony at yung experience po ninyo when you were in Dubai for the ceremony? Well, kahit mga key moments po.
So actually, the awarding started with a summit. That was a whole day event. It was participated and attended by different speakers from different healthcare sectors, and the focus of the summit is about artificial intelligence. So it is a start of a new era already for the healthcare community, and so that's one thing for me that's very significant on that day. So what else? How about you, Doc?
Naalala ko lang, aside from what Dr. have said, during the recognition itself, we are given really recognition, isa-isa kami naka-red carpet. So, yung feeling kasi na talagang na-recognize ka, you are so very blessed and very honored talaga na somebody noticed or somebody was there na ang service na ginawa mo.
And sa totoo lang po, like from yung mga background po ninyo, aside from being healthcare professionals, marami talaga kayong service sa community. Actually, since nabanggit nyo, baka it would be okay to take a chance to share a little bit yung organizations that you're a part of, tsaka yung mga past or future projects. Briefly lang po about yung mga plano po ninyo.
Ako kasi I started aside sa PPOQ, first I've been the auditor, president, and vice president of the Philippine Nurses Association here in Qatar since 2017. I've been an officer. Ang nagawa po namin is hindi lang po talaga sa nurses, not necessarily sa nurses. Tumulong kami sa mga underboard ng nurses. Tumutulong kami for the review, for them to become registered nurse para mapatuloy din nila ang kanilang mga pangarap. And also we've conducting, we called it the CSSW for the student in PSD. So we shared to them our experiences as nurses and as a medical profession, and also sa Filipino community. We've been conducting medical missions and at the same time blood donations here also. Baka Doc may idagdag.
And as part of the community also, the PPO Qatar chapter also would like to help a lot of Filipino in the community. Kasama rin ang optometry group, ang IPAO, which is Integrated Philippine Association of Optometrists Qatar chapter, which was I was the president from 2016 to 2022. So as a leader also in the Philippines, parang gusto ko dalhin dito sa Qatar yung importance ng pagiging optometrist, Filipino optometrist. So, nag-gather kami ng mga optometrists, which is very parang ma-explain namin lahat sa community yung aming importance. Hindi lang just because may mga ophthalmologists pa, but for the Arabic, Middle East to understand what's the importance of being an optometrist. So, in-explain lahat namin yon. Tumulong kami sa community ng PPO. Pumunta kami sa shelter to give also a lot of things, yung help na pwede maibigay. Plus, medical mission also were also included that time.
Okay, for the part of medical technologists, so PAMET Qatar is quite new. We're like 6 years only in Qatar. So we started in 2018. And then we have several projects like the first one is the first SPLE, a special licensure examination for medical technologists. That is usually wala pa yan dati. So ngayon, last year, nag-start siya. Oh, actually this year. This year siya nag-start, and it is open not only to Qatar but other Middle East countries and also in Singapore. So that was the first special licensure examination for medical technologists, and also some CPD activities also and medical missions. Yeah.
Thank you.
So I was a member of the Filipino Medical Association Qatar, and we also conduct some medical missions. And aside from that, I was also a board member of the BOD Secretary of PSD Philippine School Doha. So we are actually a large community because we cover the whole families of the Philippine School Doha. How many students in Philippine School Doha? It's around 3,000 to 500. So with that, we were able to reach out to some families as well who are needing help financially. So we're doing the same. And we also conduct webinars. We did that for monthly. Several topics include healthcare, mental health care awareness, and also financial literacy program and leadership training. So those were just a few of the many things that we can provide to the Filipino community in Qatar. And congratulations to everybody because we're doing a lot.
You are doing a lot. Actually, given everything that you're doing, ano po yung mabibigay nyo na advice for those who are healthcare professionals here in Qatar and who want to be healthcare professionals abroad? Lalo na sa specific fields ninyo.
Okay, so like sa nabanggit kanina, I frequently go home to deliver some talk and lectures on point of care testing in the Philippines. So by doing that, I want to share my experiences and skills with my fellow medical technologists in the Philippines. So that is one thing that I want to ask also some our fellow kababayans here abroad to share what they have learned abroad with our fellow kababayans in the Philippines, so that they could also have at least experience the things that we have learned and experienced here.
Actually, sorry po, gusto ko lang i-follow up kasi nabasa ko po kayo ay big advocate of point of care testing improvements. Pa-explain naman po, what is that? And yung sa advocacy nyo?
Yes, so point of care testing actually is a laboratory test. Doc could really relate on that, and Sir Sergio. So these are laboratory tests done at patient's bedside. So usually, ang common, ang traditionally we will go to the lab, we have our test done in the lab, but this time, this point of care test, it is a small devices that we can bring to the patient's bedside and do the test at the patient's bedside. So in that case, we have the results immediately. No, right there and then we can have the result, and the doctors can manage the patient immediately. Okay, so it has a shorter turnaround time. So the intervention is given to the patient immediately, you know, especially in emergency cases. So I'd advocate that because it's not because we want to replace the laboratory. Not it is actually an extension of the laboratory. So it increases the capacity of the clinical laboratory, being the test being done outside the lab. No, so the bottom line is we deliver immediate care. No. By giving an immediate result, then the doctor can act on the patient and manage the patient accordingly based on the result taken from the point of care device. So I advocate that because when I did my thesis in the Philippines, my master program, one of the things that I recommended on my thesis is to have a national policy on point of care testing in the Philippines, which we don't have right now. So yung practice sa atin parang kanya-kanya, sabog-sabog. So it is nice to have a harmonized practice, and especially during the time of pandemic, point of care testing was really highlighted, especially yung COVID testing, no. Yun yung isa sa mga very prominent point of care test na nagamit very recently is during the COVID-19 pandemic.
And I can imagine there's so many ways in which this can really revolutionize how yung patient care. Nakikita niyo po ba yung may developments dito sa Qatar na dun sa mga technology na nagbabago that it's being implemented here po?
Yes, actually, technology it's very fast moving ng technology, especially here in the Middle East. Marami tayong advanced na technology here, even mga equipments, especially yung topic nga dun sa summit is AI. Actually, it is being implemented in the field of medicine already, no? Right? Like sa amin, no? Meron na kaming mga algorithms in place na right there and then pwede mo nang i-interpret yung result in the absence, for example, hindi agad available yung physician. That is it is being developed together with the medical profession to develop algorithms that that can be followed, no, to act immediately on certain cases.
Actually, maganda pag-usapan po sana kung ano yung mga development sa AI na specifically sa mga profession ninyo, sa field ninyo, na nakikita nyo yung improvement and the implementation. Pero bago tayo pumunta doon, I wanted to ask more of yung personal experience nyo dito sa Qatar. Kasi collectively, you've had many years of experience here, working here. What are some of the challenges, the cultural challenges that you face in your specific roles here in Qatar?
For me, the first challenge that I've encountered is communication. We know na their language is different from us. So number one talaga na before we will go to any other countries, we should know at least ang basic languages or basic terminologies and words na kailangan mo in your profession. And next is we should know how to adapt to not only to the changes but most especially to the culture. We should know how not only adapt but we should also know how to respect. We should adapt and respect the culture of every country that kung saan man tayo.
So as a doctor, physician, I see different cases every day. And the challenge that I face is actually living and practicing in an age wherein technology and information is easy access. So what's the challenge with that? No, of course, a patient can access the internet, and you don't know which one is acceptable, valid. Those are false information. So the challenge with me as a physician is how to come across the patient's knowledge, kung tama ba yung naintindihan niya, na tutunan niya, na babasa niya sa internet. Because these information which are false most of the time can cause anxiety in most cases. So it's a challenge. But of course, if a doctor can really sit down with the patient, spend time, quality time, and understand where the patient is coming from, you get to understand fully the disease. So that's not even a challenge. That's more of some deviation from the path. So it's manageable. So that's for me.
With regards naman pagdating sa optics, no? From way back 2007 to compare yung this year, and after the COVID kasi, a lot of kids or adults are using computers. So yung new technology na lumabas ngayon is with blue light filter. Meron ba dyang, as sa Arabic magsasalita na, do you have some lenses na okay ang hemaya or yung mga term. So you have to learn You have to learn and explain to them these are the specific lens that you have to buy and these are the good lenses for your kids. But they have to understand that hindi siya basta lens lang. And we're not just talking about the price itself kasi baka mura lang, baka mahal yan, but the quality of the lens which can protect the eyes of the kids, especially the kids. Kasi even yung mga age ng 10, talagang tutok sa computers and all. So, we're very specific na i-explain lahat sa pasyente yung ganong klase ng nagiging problem these days because of this technology na.
Aside po from the technology, and specifically sa climate natin po sa Middle East, specifically sa optics, ano po yung mga napapansin yung karanasang common problems and ways in which we can care for yung eye health given the climate here in the Middle East? At saka yung dust,
yes.
change of
Compare
weather
kasi sa Philippines, no, dito napakainit talaga. Sometimes nga meron tayong 48 to 50 degrees. So meron tayong 20-20 rules na tinatawag. Tingin ka sa malayo ng 20 feet, break ka ng 20 and blink at least. So 20-20. Kasi kapag when you look at infinity and then you blink, that means nakarelax ang eyes mo. You can feel na medyo naluha ka na. So pag naluha ka na, that means super pagod ka na and you focus too much kasi the computer. So yun yung time na mararamdaman mo yung sakit ng ulo, sakit ng mata and all. So meron kaming mga ganong klase ng learning para sa mga estudyante. Pwede rin naman namin explain and everything yun. Kailangan talaga yan. To be relaxed also.
To be relaxed. So
Yes.
makikita niyo po ako, magbe-blink lang ako na magbe-blink.
Yeah. Actually, kailangan at least 15 to 20. At least 15 to 20. Every 15 to 20 minutes nagbe-blink ka talaga. Kasi once you focus at nakatuto ka sa computer, nagda-dry kasi ang eyes natin. Merong specific na test na ginagawa dyan. Strip ang tawag doon. But then, those kind of internal eye testing or check-up nasa specialist na kasi dito. So, all optometrists are only into refractive errors lang here in Doha. But then, in the Philippines, we have a lot of experienced specialists in visual training, sa mga bata, yung mga medyo naduling dyan, yung ganun nagagawa yun sa Philippines lahat. But here in Doha kasi, we are limited lang into this kind of refraction lang. Thank you.
And gusto ko din magtanong po about this overload of information which I feel like applies in all of your fields. Ano po yung what advice would you give sa mga Filipinos na who have access to this information? How to deal with it? Kasi you touched on that, Doc, kanina. So what's your take on that? Paano ba mag-deal with all of this overload?
Yes. So once you go to the source of the information, of course you check where it came from, who are the authors, correct? And the challenge is to actually apply to a person what information you gained, right? So, syempre yung ating mga pasyente, hindi naman sila, equipped to understand everything. So, always, we advise that to consult. Because we cannot prevent anyone from not going to the internet.
Yes.
It's part of our life na.
Yes. We're all guilty of this, I think.
Yeah, so if you are really needing some more validation, just consult. That's the only way you'll be able to be at the safe side.
Okay, absolutely. I like that. And that's a reminder to all our listeners there, especially to my mom. Let's not go to Dr. Google, but yes, as you said, to consult. Actually, if you could change one misconception about your profession, what would it be?
Siguro for medtech, no? Common yung pag nakausap ko na, medtech ka pala, kala ko yung nagpapatalastas lang ng sabon, no? If you would remember that, no? The commercial of one of the brand of soap in the Philippines previously, mga medtech yung nagpapatalastas dati. But more than that, more than the commercial, more than and probably the most common part of the laboratory na na-encounter ng patients are the one that are collecting blood, no? But more than the commercial, more than the person who is collecting the blood, in the laboratory we do a lot of tests, and we make sure that the results that we are giving to our patients and to the physicians are accurate and reliable. Okay, so we follow strict quality assurance in the laboratory. We make sure that our lab pass quality control tests, the reagents are dated, and all those. And of course, the person performing the test, the medical technologists, are competent. They are well trained. They are all licensed. So more than that, the commercial so that is what I want to say. Especially during the pandemic, doon na-highlight yung mga medtech, di ba? During the pandemic, kami gumagawa ng mga tests. So yun. So that is one of the misconceptions. Kala nila, kami lang yung nagko-commercial.
Sa part naman ng nurses, quote and quote, usually when they say nurses, we are very dependent on the doctor's order. Naka-rely lang lahat ng trabaho namin sa order ng doctor. No. It's a big no. We are nurses. Yes. I am a nurse and I am a nurse. Bilang nurse po kasi we have our own independent function din naman. Independent in the intervention that we should not rely on the doctor's order all the time. In cases of emergency, you should know what you are going to do. Kailangan po natin ng critical thinking din kasi.
Absolutely.
I can actually relate and agree to that, Doctor, 100%, because as doctors, we cannot do it alone. It's actually a team. The nurses, medical technologists, eye doctors, and everybody in the healthcare community work as a team. We cannot only take the credit from the side of the doctors. No, it's actually a team. We are the actors in our own movies.
And we have our own parang specialization. With regards to optometrists and ophthalmologists, kasi nagkakaroon ng differences kung ano nga bang importansya sa pagiging optometrist. Usually, optometrists are the one who iniisip nila, gagawa lang ng lens yan, ikakat lang yan, bebenta lang yan, ganon. No, kasi napaka-important ng role namin as an optometrist bago different ng i-compare sa ophthalmologists. Although ophthalmologists are the ones who do the surgeries, transplant, like that. But then we have also a specific sub-specialization, which is, before kasi we only have about 4-year course to 50, including the board exam. So we are all licensed here in Doha also to tell everybody. Lahat ng optometrists na makikita nyo po sa optical na Pilipino are all licensed with their QCHP license. And hindi lang po basta nagbebenta ng salamin or lente, kundi yung specialization po namin, binibigay po namin sa lahat ng mga tao dito kahit ano pong nationality. And then with regards naman po sa pinaka problem internally, saka po kami nagbibigay ng referral sa mga doctors na connected sa amin kasi hindi po kami licensed as a surgeon. So yun po yung difference na medyo naguguluhan sila, baka akala po nila nagbebenta lang kami. So hindi po ganun yun.
Ako sana naman po after nitong interview na to, alam na ng mga kabayan natin talaga yung difference ng optometrist, ophthalmologist, tsaka yung contribution po ninyo sa medical field.
And sorry, another thing is may mga nagiging problem ngayon kasi mga online selling. Be careful po doon kasi hindi po lahat ng mga blue light lenses ay talaga pong maganda at para sa mata ninyo. So yun po. You have to consult the optometrist and all the licensed optometrists, even po ibang lahi, but as we speak about the Filipinos, so ang mga Filipinos po ay talaga hindi po kayo lolokohin.
I trust that. Siyempre po. Kayo po, Doc Diane Bansol, yung mga misconceptions about internal medicine.
So internal medicine, I'd like to actually clarify. There's no misconception, but internal medicine is a doctor or physician that targets the internal organs. So from head to foot. The brain, the heart, the lungs, the stomach, the GI tract, the kidneys, musculoskeletal, and so on. So it's a general doctor. So we may be regarded as a general physician, which I agree as well, but the training is further than the general physicians. We undergo further residency training that encompasses around 3 years, up to 4 years, and we have board exam again after the general board exam. So it's a misconception that I can say, and we are specialists in the field. And before a cardiologist become a cardiologist, they will pass through the internal medicine. So if I decide in the future, hopefully, that I want to become a neurologist, I'll do again a further subspecialty training. But yeah, that's the usual misconception.
I have a question po for
Yeah,
you,
sure.
Doc Diane. They say that nowadays it's the symptoms that are being treated and not the core problem, the core sickness. What's your take on that?
Actually, I have a different observation with efforts that Ministry of Public Health are doing recently. The shift is towards the prevention, towards proactive, especially here in Qatar. So Ministry of Public Health, together with large facilities like Hamad, Sidra, and all other private sectors, are actually leaning towards providing, proactive health care
versus prevention.
Exactly. But I'm not saying reactive healthcare is bad. I'm not saying that. We just have to balance and to recognize when do we apply. Because reactive healthcare is applicable for emergency cases, infections. When you have a symptom of infection, then you will give the antibiotics. But if you don't have signs and symptoms, you will not give. So that's a reactive healthcare, right?
Yeah.
If you have an abdominal pain, then it's supposed to be an acute appendicitis, you have to react on it, right? So it's applicable, reactive healthcare, to different cases, and the others will be proactive healthcare. So it should have a balance between the two.
It's nice to see that there is, especially here in Qatar, that shift, which I think is aligning na rin with the global shift towards this prevention. And what's your take po on like holistic health care?
So holistic health care is like lifestyle medication, encompassing how the patient has its unique biology, unique microbiome diversity, unique lifestyle, and then applying all the knowledge that you get in order to give the treatment. So that's the holistic way. So not only all medications are being provided, prescribed, you write down the medicine 1, 2, and 3, and 4, and so on, but you also, discuss why this patient has developed the symptoms, the root causes. Because when you study the root causes, you'll be able to have a more successful treatment outcome. So that's holistic wellness. There are different labels to it, but those are just labels. Holistic wellness, lifestyle, functional medicine. What else? Conventional, what they call this, Chinese medications, but all boils down to determining and identifying the root causes.
I see. Dr. Diane, you have a specific research on diabetes and metabolism. I know we don't have enough time for you to share everything, pero baka naman po meron kayong specific breakthroughs or something that you would like to share with our kabayans about this specific expertise of yours or passion of yours to research on diabetes and metabolism.
So diabetes is a very common leading cause of death all over the world, and because of the complications, that's why it's cause of death. So recently, there was a increase in the use of hormone analogs called GLP-1 agonists, wherein a patient was being suppressed in eating. Yeah, because patients with diabetes tend to eat all the time, eat more. Every 1 hour, they feel hungry for the reason that it's the symptom of the diabetes. On top of it, the medicine that we're giving basically decreases the blood sugar level and gives a signal from the brain to the body, to the stomach, that I need to eat.
Yes.
And there is a new set of medication which stops that signal, and this allows for us to manage more successfully the uncontrolled diabetes. So that's part of the diabetes research. I hope all the diabetic patients will also be able to consult your specialists or doctors in order to understand and discuss and sit in what are the options for you.
Doc, diabetic ako.
Yeah, exactly.
So, mag-uusap tayo.
Yes, why not? Let's go.
Consultation na.
Oo, consultation na. Actually, magandang opportunity. Pero actually, Doc Jane, I wanted to ask you, nabanggit mo na to kanina, pero siguro kung meron kang 3 tips para maalala ng ating mga kabayan for, spending, because all of us spend extended hours in front of our mobile phones, in front of the screens, laptop, watching television. What advice can you give for preventing this digital eye strain? And kung meron na bang bagong mga developments? So nabanggit you mentioned a few tips a while ago. Maybe you could give us more, elaborate more.
Basta every year, at least once a year, meron kayong dapat eye test to follow up. And then especially kung ang mga anak nyo po ay less than 10 years old at nakikita nyo po hindi masyadong nagfo-focus, maybe may problem sa eyes. Kasi sometimes ang mga kids po hindi nagsasalita yan eh. So it's very important din po na one time we did our medical mission at saka sa school, we teach the upcoming grade 12 ba yun?
Upcoming college.
Upcoming senior high po ang inassist namin for them also to know okay, it's important din pala. So kailangan talaga po makita nyo tsaka makausap nyo ang inyong mga anak kung ano nga bang problem kasi baka po kaya low ang grades nila, hindi nakakakita. So at least once a year or every 6 months po may check up ang mga bata.
Okay.
Can I add?
Yes.
Because this is very important. I have a kid as well. And it's so sad that very seldom that we see kids without eyeglasses now. So the primary reason for this is actually the gadgets. So for the moms and dads out there, kindly limit the exposure to your gadgets. If you can set 1 hour only in the morning and 1 hour in the afternoon, kindly do it. And you have to be strict because you are the parents. The kids must not be the one who's going to be, following or implementing the rules in the home, right? The parents must be the one who need to lead this.
And there are also cases na sinasabi, ang sakit ng batok ko, ang sakit ng likod ko, something like that, no? So kailangan medyo aware ang parents with regards to that kasi baka akala nyo yun ang problema, yung pala mata. Kasi dok, nakaganyan, whatever. So all the consultation dapat nandoon lagi talaga.
And aside from that, yung prolonged sitting and in front of the computer, it also affects the posture, no? So kailangan meron ding ergonomic chairs kayo to support, no? So but of course, kailangan din limited, as Dr. Have said.
I have a question, Sir De Torres, about Sir Mel na lang.
Mel na lang.
Ano po yung mga lab tests that yung mga common lab tests that Filipinos should consider getting regularly to monitor health, and why? Actually, nabanggit nyo na, Doc, yung about the eye test every year. Actually, I don't know a lot of people who do that every year kung may problema lang sa mata. So, kayo po, what are your other suggestions sa mga dapat regular na take ng mga Filipino?
Actually, I asked kanina nga, Dr. Maybe you should be answering this question, but before I give the floor to Dr. Ano. So as medical technologists naman kasi, we follow whatever the doctor have ordered na test, no? But for my side, based on my observation, kasi common sa atin yung we go to the hospital or to the doctor because we're sick. But it should be instead na we will go to have executive check-up probably, or more of a preventive medicine style nga, instead of may sakit ka lang kaya ka pupunta sa doctor, something like that, but more a consultation more of how to improve your health rather, ganon. So for laboratory tests, probably a basic metabolic panel will do, and CBC. For certain group age, like male for more than 40, it should be PSA, and also for the ladies,
PSA?
Prostatics, specific prostatic antigen, and also for ladies, maybe some tumor markers and pap smear probably, and breast tests, something like that. Yon. So I think Doctor can add more.
That's a lot for regular testing. But
Yeah, actually, that is correct. And my primary message to everyone, especially to people with families, no? Alamin niyo po kung kailan ang birthday niyo, then set that as your annual checkup, so that you will not forget. For example, itong si panganay, birthday ganito, pa-check mo ng araw na to before mag-lakwat siya. si tatay magpa-test ng muna bago,
Bago birthday cake.
Yes, exactly.
Bago kumain ng birthday cake, may test. I'm gonna implement that from now on.
And yeah, I think that's a nice idea. And also yung pag meron na tayong nararamdaman, mag-consult na agad. Don't wait, no? Then rather malaman natin too late na, no? Kasi minsan may mga cases na kung makikita natin siya ng early, it could still be cured and prevented. Diba?
Sir Mel, ano po yung nag-inspire sa inyo to enter your profession as a medical technologist? Nagkaroon po ba ng moment in your childhood, or was this something that your parents asked you to do? Ano po yung nag-inspire?
Actually, I want to be a doctor. Yun ang unang-una, no? And during that time, no, one of the best pre-medical course is medical technologist. And sabi nga, tanda-tanda ko pa yun, sinabi ng nanay ko, no? Sabi ko sa kanya, Nay, pag nakapasa ako ng NMAT, magme-medicine ako. Kaso hindi eh. Pero sabi niya, sige, pag nakapasa ka, subukan natin. Pero sabi niya, di naman niya, no? Patapusin mo muna yung mga kapatid mo. Kasi panganay ako. So, baka dalawa kang course yung mga kapatid mo, hindi makaisa. So, instead, nagtrabaho ako. And then, siguro talaga dun yung calling ko, no? Because I won't be here naman.
Yes. At saka, yung mga advocacy nyo and yung pagsali nyo sa mga organizations and leading the organizations, parang passion niyo po talaga yung medical field?
Actually, siguro, ganun nga talaga. Actually, when I was in Saudi Arabia, I started working sa Middle East in Saudi Arabia. I was there for 16 years. Nagplano kaming mag-put up doon ng PAMET Saudi Arabia chapter, pero hindi siya nangyari, no? Kasi nga nag-move na ako dito sa Qatar. Then dito siya sa Qatar nangyari. Never in my life I was an officer in an organization before, no? But siguro ito lang talaga yung that siguro yung nga yung reason bakit ako napunta dito.
At ngayon you were also now a resource speaker here in Qatar tsaka sa Philippines din, no?
More ang passion ko siguro talaga is to teach, no, and to train fellow new generation of medical technologists. Because sa SIDRA, ang trabaho ko din naman is to train healthcare professionals on how to perform point-of-care testing.
It's amazing. And I really love this point-of-care testing, that it's improving, revolutionizing. Kasi malaki talaga po yung makakatulong niya for, dealing with the emergency cases and all the many cases that come up. It's really interesting to know. Actually, I have a question for Sir Serio. Meron po ba kayong specific work experience that has left a lasting impression in you and, influence you also sa mga various leadership roles ninyo?
Actually, it's as a nurse, it's not just following doctor's order as what I've said. Nandun din po kasi yung kaming nagko-coordinate ng lahat ng healthcare professionals, or what we call the healthcare professions who are taking care of the patient or who are involved in the patient's care. So we have the dietitian, we have the technician, we have the doctors, subspecialties. We are the one who coordinate with them. So siguro as a nurse, doon ko rin na-learn on how I will deal with all the professions, yung pag-deal sa kanila ng iba't ibang way. Doon ako na-inspired kasi na it's not only that I will deal with the doctor, it's not only that I will deal with the X-ray technician. So doon po kasi ako na-inspired kung bakit ako and also the service and the care. Once we take care of the patient, it's only a thank you from the patient and from the family. Doon ka na na-inspired to help and to reach out to other people.
So sabi mo, it's not enough what you're doing in your profession. You even reached out to more OFWs for your medical missions, for organizing events, and for the blood donation drive. So many things. So talagang inspiring din po kayo kasi it's already you're giving so much already in your profession, and you said it's not enough. You want to give more to our fellow OFWs. So it's really wonderful po. And last na lang po, ano yung mga unique challenges that are faced by many of our nurses working here in Qatar's health care system, or some mga specific unique challenges to mga nurses here in Qatar, and what advice would you give to overcome those specific challenges? Na-mention niyo po kanina yung communication, so definitely to learn the language before coming here, before embarking on that journey. What else pa po?
Yun din yung cultural adaptation. Alam kasi ang iba't ibang countries or iba't ibang may iba't ibang kultura na dapat natin respetuhin. Yun yung sinasabi ko rin kanina na before coming here, especially in the Middle East, 'di ba may pre-orientation tayo na or what you call PDOS. Yes. We should give attention to that kasi doon din tayo na nakakakuha ng konting idea. Then also at tayo din as a person, alam natin na pupunta tayo sa isang lugar. We are new to that place. We should learn. We should read, at least alamin natin yung mga do's and don'ts of that country.
Great advice. Actually, I wish we had so much more time because there's so many things I would love to ask each of you individually. And sa totoo lang, ang ganda-ganda ng discussion natin. And I feel like we just touched the tip of the iceberg and the amount of the valuable information that you guys can share with us. It's really a vast wealth of knowledge, experience, and your contribution to the community is truly an inspiration. And before we go to the second part of our Usapang Qabayan, I would like to invite you to greet some of our viewers, family and friends.
Okay, so I would like to greet my wife. Sabi niya manunood siya ng live sa FB, and my 2 sons, of course my family, my fellow medical technologists here in Qatar and all over the world. Mabuhay kayong lahat. And of course mga Batanggenyo, ako'y narin
Magandang gabi po sa lahat. I would like to greet all the Philippine Nurses Association Qatar, especially to our officers headed by Presnoy. Magandang gabi po sa inyong lahat, and shout out po sa lahat ng Filipino nurses ng HIA.
Ganon din po sa akin. Shout out ko din ng Integrated Philippine Association of Optometrists Qatar Chapter, especially po ang ating president ngayon, si Dr. Grace Castillo. Also, ang Las Damas de Rizal. Magkakaroon po kami ng event at dahil nga po October is Breast Cancer Awareness. So watch out. Tama ba? Just wait po for our further announcement with regards to that. So yun po. Thank you.
As for me, I'd like to say hi and good evening to everyone from the Filipino Medical Association Qatar. And I'd like to say hi to my son, Prince, and of course to my family and friends, and especially the members of my, if I could mention Doc Medical Clinic family. They're so supportive of me. I'm the only Filipino doctor there, and they have recently promoted me to consultant level. It's actually very, very, I'm immensely blessed to them. So thank you and hi.
Pahabol po. I would like to greet also the Filipino community, especially the PPOQ, headed by our new chairman, Chairman Phil. And also to all the emergency nurses, to my friends.
Special mention lang po ang aming boss, our CEO and Managing Director po, Mr. Moin Yagane Paksad. Thank you po for allowing me umattend dito. Thank you.
And also thank you to Sir Marvin, to Chairman Marvin, for nominating us. Maraming salamat po.
Yes. Sir Marvin, thank you so much. Thank you.
Thank you so much. Thank you guys for your time. Thank you for being role models in our community, and I really wish you all success in your careers and future endeavors and the future endeavors of the organizations that you are part of. Now we will be going on a short break, and then I shall be introducing our next guest for the second part of Usapang Qabayan. Thank you, and don't forget to like and share this episode of Usapang Qabayan. We'll be back shortly.
Usapang Qabayan! Usapang Qabayan! Usapang Qabayan!
Craving a sweet treat? Indulge in DQ's irresistible blizzards and celebrate your happy moments with DQ cakes. Visit Dairy Queen today. DQ, happy tastes good.
Come and get Diana Jewelers trendy 18K gold earrings for just 169 Qatari Riyals. Or treat yourself with our bestseller diamond ring, the perfect gift for all occasions for as low as 487 Qatari Riyals, and enjoy the convenience of 3-month payment options. Purchase any of our products in store at our Al Saad main branch behind Royal Plaza Mall, Al Nasser branch, or Qabayan Souk. Prefer shopping from home? Yes, you can with our free delivery with your online purchase. Follow Diana Jewelers Facebook and Instagram pages at Diana Jewelers or call 5598-6224 or 3362-0923.
Carrefour Qatar, our 24th anniversary is here. Get a chance to win up to 2,024 free trolleys filled with goods in 14 days. Fill your trolley and you could win it for free. That's not all. Enjoy My Club points on your favorite products, plus exclusive deals on groceries, household essentials, electronics, and more until 9th of October. Terms and conditions apply. Visit your nearest Carrefour store today and don't miss out. Carrefour, 24 years anniversary.
Craving mouth-watering seafood? Head to the Nat Al Bahar Fish Barbecue for the tastiest catch in town. Swing by Old Souk Wakra or Souk Wakif Doha for the freshest seafood, cooked just how you like it.
Blue Salon's big sale is back on. Shop for your high-end products at up to 50% off this October. And that's not all. Use code BSALE24QB at checkout for an extra 5% off your purchase. Don't miss out on this unbeatable savings from October 1st until the 30th. Shop now.
The current time is 7:42.
Qabayan Radio 94.3 FM remains dedicated
to delivering a diverse range of music and entertainment,
along with up-to-date news and reliable information.
Our dedication extends to offering public services
and nurturing collaborations between the public and private sectors,
connecting with the local,
Filipino,
and international communities.
Proudly standing as the first
and only Filipino radio station in Qatar.
This is
Qabayan Radio 94.3 FM.
Qabayan Radio 94.3, loud and proud.
Mga kababayan.
Qabayan Radio 94.3.
You decide, we play it right here.
Okay.
On Qabayan Radio 94.3.
Hold up.
Fasten your seatbelt because we are about to take you on a musical journey around the world.
If you're targeting the Filipino community and other English-speaking audience in the country, placing your advertisements on Qabayan Radio is a wise decision. With over 300,000 unique web users, exceeding 1.3 million web page views, and boasting a substantial following of over 70,000 on social media, Qabayan Radio 94.3 FM stands out as the leading advertising partner for your brands. Speak to our sales team now. Call 44994944 or email at info@qabayanfm.com.
Tuned in to the number one Filipino radio station in town.
All right, gotta keep moving.
Qabayan Radio 94.3. 94.3. We're bringing you the best information. And non-stop entertainment.
Too late to turn back now.
So keep it locked right here.
Usapang Kabayan! Usapang Kabayan! Bibigyang linaw ang mga usaping nagbibigay ng interes sa mga kababayan. Sasagutin ang mga katanungan tungkol sa mga isyong may kinalaman sa mga overseas Filipinos. Magbibigay ng mga impormasyon at kaalaman para sa mga mamamayan. Ito ang Usapang Kabayan! Usapang Kabayan! Sabayang mapapakinggan sa radyo at mapapanood live online. Dito lang sa Qabayan Radio 94.3 FM.
Good evening and welcome back to Usapang Qabayan. With me, Tasha, your host for tonight, and I'm really excited with the three individuals sitting next to me now. So good evening and thank you for joining me. It is really a privilege to have our guests join us tonight. They are the recipients of the Top Healthcare Professionals in the Middle East Awards 2024, and earlier we spoke to four also who were awarded, and now we have the three individuals I'm excited to introduce today. And this is actually one of the recent awards among the many accomplishments among the three of you, among the many accomplishments, recognitions, and contributions to the community. So joining me tonight is the current president of the Nutritionist Dietitians Association of the Philippines and practicing hospital clinical dietitian, Ms. Carla Padrelanan. Welcome.
Hello, good evening.
Good evening. And in the field of dentistry, we've got Dr. Rosana Miller Barrera. Welcome po.
Hello, good evening, everybody.
And Dr. Christian Marvin de la Cruz.
Hello, good evening to everybody.
Thank you, po, for joining us tonight. So I just want to give a more in-depth introduction because it's really to do you justice for your many accomplishments. So Dr. Christian de la Cruz is an immediate past president of the Filipino Dentists Organization in Qatar. He's a recipient of various recognitions from the Philippine Overseas Labor Office Qatar for his exceptional effort, support, and unwavering commitment to OFWs in Qatar through noble charitable works. He's also been awarded the Distinguished Chairman's Citation from the Philippine Professional Organization in Qatar, spearheaded the medical mission in cooperation with the Migrant Workers Office and Philippine Embassy in 2023, Doctor of Dental Medicine with proficiency in clinical orthodontics, and currently working in the dental department of the Primary Healthcare Corporation in Doha for 18 years and counting. And actually, there's so much more, but I hope I covered at least the general for our kabayans.
Yes.
Thank you. And also Dr. Rosana Miller Barrera, current president of the Filipino Dentists Organization in Qatar, FDOQ, and 18 years of experience in the Middle East healthcare industry, facilitator and lecturer for career simulation seminars at the Philippine School of Doha, and named one of the 7 outstanding men and women of the Philippines in 2023. Amazing accomplishment, together, of course, with this award, with the recognition of the top healthcare professionals in the Middle East. And Ms. Carla Padrelanan, current president of the Nutritionist Dietitian Association of the Philippines Qatar Chapter, Strategies Communication Chair at the International Affiliate of the Academy of Nutrition and Dietetics. Did I say that right? Dietetics?
Yes.
Yes. 12 years of experience working in the Middle East, is a registered nutritionist dietitian in the Philippines and U.S. registered dietitian, and practicing hospital clinical dietitian in Doha. Also a certified nutrition support clinician and fellow of the Academy of Nutrition and Dietetics, and recipient of the International Affiliate of the Academy of Nutrition and Dietetics Service Awards. So, wow, quite the credentials sitting next to me, and I'm really excited for our discussion tonight. So thank you for being here. Thank you for spending your Saturday evening with us. So how does it feel to be recognized as the top healthcare professionals here in the Middle East, lalo na dun sa awarding na nangyari dun sa Dubai?
Okay, it was an honor to be recognized as a top healthcare professional in the Middle East. Kasi Middle East yun eh. So also I feel a sense of accomplishment as a professional. So there is this feeling na I've contributed at least sa profession. And honestly, it's also a pleasant surprise because I'm just merely doing my part of the service as a professional.
Where were you po when you found out that you got this recognition or award? Nung nalaman po ninyo?
Yeah, actually, core memory ko na yun eh. Nagtatrabaho lang ako. I was just working, assessing patients, documenting. Then I suddenly received a message. So, yun lang yan.
Wow, sa'yo naman.
Yeah.
All of a sudden, biglaan na lang.
Yeah.
So, you didn't have any inkling po that you were nominated or anything like that?
I was nominated. But it's not really expecting na talaga makukuha yung ma-recognize as top healthcare. So we together with my two of my colleagues, si Sir Jeff and Miss Michelle, we received a message. So we just accomplished answered questions and submitted the requirements. Then that's it. Then we just received a message.
It's amazing. Kayo po, how does it feel?
Of course, feel so blessed kasi 'di ba out of 600 and then 129, so 'di ba parang ang dami namin sa Qatar, and actually marami namang deserving. It's just so happened that hindi lahat is aware, and then yun, parang blessing and thanks sa family, PPOQ family and my family, my husband, ang mga anak ko dyan. So parang biglaan, and di ko rin ine-expect kasi parang bukas na yung last parang mayroon kang confirmation, nasa spam. So hindi na ako nag-expect kasi si Chairman Marvin ang nagsabi sa akin na Rosana, please yung CVs, everything. So hindi ko siya naasikaso. Nasa Pilipinas ako, nagbabagyo-bagyo pa. So I have a friend na siya yung sabi ko, ito yung mga kailangan natin sa kailangan niyang sagutin. Binigay ko yung CV and everything. So hindi na ako nag-expect, parang sabi ko bahala na, kasi parang 7 years na ako wala sa dental Nasa universities ako Well, Cornell, Qatar University and UDST. So sabi ko baka hindi dun mag-focus sa sa simulations. So wala na, hope. Wala, parang okay lang. At least nag-try, kaya wala.
Meant to be po.
Oo, parang dun ko na-realize na there's nothing harm in trying. Try and try. Walang mawawala, okay?
Doc Christian, kayo po.
Actually, I was surprised dahil I was also in the Philippines when I received a message from Chairman Marvin saying that, Doc, I'm going to nominate you for this coming 2024 top Filipino healthcare professionals in the Middle East. So when he said that, in my mind, I said it's going to be impossible because imagine the whole Middle East region and how many healthcare professionals are there. And then he said, try mo lang, Doc, because I will push this nomination because you really deserve for what you did during the last medical mission, and kailangan ma-recognize yun. So I said, sige, ano pa ba mga kailangan, Chairman, para umandar yung nomination? So he told me to submit some documents which I provided him. And then before I flew back to Qatar, I received an email from the organizing committee, and then they were telling me that I was one of the nominated healthcare professionals na napili nila to be awarded with this prestigious award. So when I came back to Qatar, I told my wife I have to go there, and at the first question was, kababalik lang natin galing bakasyon. So, alam mo naman, pag galing bakasyon, yung funds medyo limited na. But, syempre, my wife was there to support me, and I'm very thankful for her support and made this possible for me.
Oh, that's so sweet. Thank you po. Actually, you mentioned the medical mission that you were part of and that you also got a recognition for. Could you share a little bit, Doc Christian, about that particular medical mission?
That was around September yata or October 2023. Actually, it was organized by our Assistant Labor Attaché, Attorney Don Pangkog. During that time kasi, meron kasi tayong tinatawag na OFW shelter, wherein marami tayong mga kababayan, mostly mga runaway cases, ang nandun for their safety. And since they are confined in one place, minsan pag nagkaroon ng sakit yung isa, nagkakahawa-hawa na. And they are not allowed to go out of the facility because of their safety then. And in order to address that problem, Attorney Pangkog coordinated with our chairman, Marvin Tejada, and he told me, Doc, we need to organize a medical mission for them. If they cannot go out of the facility, we will bring the medical professionals to them. So he told me, I need your help. Let's organize this medical mission. I'm going to put you in charge. Ikaw na bahala makipag-coordinate sa mga medical professionals with their officers, which I did, and I'm very thankful that most of the officers of the other healthcare professionals here, they supported the mission. Andun na rin si President Mel. He was the one who provided with the laboratories. Andun rin si Doc Jane for the optometrist. I would like to thank also for the Filipino Medical Association. They also gave me their support, provided medical doctors for the medical checkup sa mga pasyente. And then their previous president, Ma'am Michelle Calapano, she provided nutrition and dietary counseling for the patients kasi with as much as possible we try to cover from head to toe, from yung physical health ng pasyente, yung eyes, yung oral health nila, plus the nutrition factor is there. And the PAMET President Presmel is also there, who provided us with all the necessary help regarding sa mga lab check-up ng mga pasyente. And also with our previous chairman, Sir Sirio Caras, since he is also the former president of the Philippine Nurses Association here in Qatar, they also provided help and gave us additional manpower.
So it was really so much collaboration also from the community. Did you ever imagine that you would be doing that kind of work? Or rather, did you ever imagine that you would be here in Qatar? What led you to being here, and what led you also to choosing your particular, actually these two questions, your particular field, in your case doc dentistry and as a dietitian and nutritionist?
So for me, ever since when I was younger, I always imagined myself working in a hospital as a clinician, working with patients. But then I also love food. So heavily tied sa akin ng food. Being use it as bonding moments with family. I always have this fond memories of my father cooking food. He's a
ano yung niniluto niya na masarap?
Yeah, meat and beans. Yeah, he would always cook it from scratch. So that would I love food. I love health, and nutrition. So later on, when I was about to choose a course, I realized that taking BS Nutrition and Dietetics would make sense.
Okay. So, and did you imagine you would end up here in Qatar?
Not really. I always take opportunity as it comes. Now, as long as it fits my goal, my professional goal, and also my personal goal, as long I would take it. But this is a wonderful surprise, in Qatar.
Napaisip talaga ako. Sige na nga, sasagot na ako. Yung honest to goodness answer. Yung mama ko ang gusto akong maging dentista.
Okay.
Ayan na. Ang gusto ko talaga, Conservatory of Music, Theater, something that performing.
Okay.
O, ganyan. Kasi cheer dance. So, nang nag-dentistry ko, okay, I'm happy naman siya. Pero deep inside, missing. Tapos lagi na lang akong nakapila doon sa audition ng ganyan sa university. So always sa university kung anong events. Anyway, hindi naman ako nagkaroon ng regret. But kahit sa Pinas, talagang nandun na yung kawang gawa ba sa DSWD. So sabi ng husband ko, alam mo, mabuti pa kaya mag-Qatar ka na lang kasi parang hindi ka timpayaman. Kasi talaga parang naging advocacy ko yan pag talaga parang marami namang ganon, pero siguro sabi niyan, kaya nung iniwan ko talaga yung clinic ko ay masakit sa akin kasi parang paano na yung mga walang kakayahan talagang like mga denture extraction na like magbabalot o nagtitinda ng saging, so pupunta sa akin iiyak. Alam nyo, talagang zero rendering services sa heart talaga. So yung number one talaga yung empathy. Yun talaga. So, inisip ko, yun siguro yung pinaka-greatest contribution ko na without knowing, pagdating pala talaga dito, hahanapin mo pa rin. Parang sabi ni husband, hindi ka ba napapagod? Nung una talaga, syempre, as a wife, tapos napasukan ko na lahat dito ng hospital, ng government, private. Sabi niya, hindi ka ba talaga napapagod? Meron ka pang Friday activities. And then later on, siya na yung nagsusupport. Kasi tapos hindi ko ina-expect na, wala naman sa akin yung expectation na in return. Wala. So, kaya naiiyak-iyak ako talaga doon sa mga awards. Kasi parang sa iba, ano ba naman yung awards? But for me, parang may maano sa akin talaga yan. Kasi pag way back, pag talaga lahat tayo nag for good, I have something to cherish na isang kapirasyos yung papel. But it's almost 19 years na.
Tsaka hindi lang naman kasi papel yun. It's the lives of the people you've touched. And also, hindi lang you managed to pursue a little bit of your passion in theater because sumasali kayo ngayon dito sa Qatar. So somehow
pasok sa showbiz. Nag-start na 2 years na and recording and everything. May mga short films and music videos. So marami.
The heart finds a way. When the heart wants something, it finds a way. And napakaswerte din po ng mga patients ninyo, yung mga pasyente niyo because yung energy niyo po na it's theatrical, lovely energy. It's also something that's not always there in the healthcare. And a lot of people are scared also of going to the dentist.
Yes.
But if you're my dentist, I will not be scared. I will actually be excited.
And ang dami ko naging pasyenteng nandito sa Qatar. Dati naglalakad ako sa parang pag tinawag, Doktora Barrera, naku, Diyos ko, taga Pilipinas to. At nagdalaga na sila. Kasi naging school dentist ako. So, yung fulfillment mo na, tas ang ganda ng dentition nila, perfect. Walang mga sira. So, yun, isa yun.
Okay. Wow. Ka-inspire naman. Doc Christian, kayo po.
Ako, would you believe, nung bata ako, ang talagang gusto kong maging pare.
Wow.
Kasi amazed ako sa mga nakaputi.
Okay.
Tapos, one time, sinabi ko sa mother ko, gusto ko yung sakristan, mag-start as magsaserve. Tapos, ang ginawa ng mother ko, parang sinali ako doon sa Marilots ba yan? Yung nangongolekta ng collection. Okay. Tapos, nung nag-college na, kasi my mother is also a dentist. So, dun sa family, mostly yung mga kapatid ko, they're following the footstep of my father, which is in the engineering field. Yung brother ko, architecture ang kinuha. Yung older sister ko, interior designing. Tapos yung bunso namin nun, undecided pa. Pero sa akin, nagbiro ako noon. Sige, magdo-doktor na lang ako para kung sino mga aksidente sa nyo, ako na lang gagamot yung mga tauhan na malalaglag sa sa field. Tapos, yun nga, nung nag-college na, nag-apply na for sabi ng mother ko, subukan mo mag-dentistry kasi doktor ka din naman nun. Sabi ko, sige, sabi ko, subukan ko. Tapos sabi ko, kung sisipagin ka pa magtuloy ng medicine, nasa sayo na yan. Pero syempre, unfortunately, hindi na nag-straight sa medicine kasi dentistry pa lang, ubus na yung oras mo eh. Imagine 6 years, bubunuin mo yan. Tatapusin mo yung mga clinical requirements. So, doon pa lang, parang, ayoko na, okay na ako dito. So, after ko graduate, I started working first with the president of Lipa Dental Chapter, which is the aunt of my best friend noon. Nag-cover ako sa kanya sa clinic niya. And during the time na nag-cover ako sa clinic niya, doon ako na-expose sa community works. Since she is the president of the Lipa Dental Chapter, meron silang mga programs with the local government of Lipa. During that time, it was Mayor Vilma Santos pa. So I was able to work with Mayor Vilma Santos with one of her dental missions sa Lipa. We provided dental services for the barangay captains. So dun sa mga nasasakupan niya, nag-perform kami ng extraction procedures. We provided free dentures for those who wants to have dentures. So from there, parang nagustuhan ko na, okay pala to. So every time na magkakaroon ng mga dental missions, I was called in to, give a hand. So until such time na, yun nga, nagtrabaho na, doon naman ako na-expose sa orthodontics. Actually, yung former boss ko, who was also our mentor, nagtuturo siya ng ortho. During the time when I was already married, I told him, Doc, I was asking for a raise. Sabi niya, sige, let's discuss that tomorrow in my office. Pagbalik ko sa office niya, sabi niya, I have 2 proposals. I could give you the raise that you're asking, or if you can think about my proposal. Sabi ko, ano po yun, Doc? Sabi niya, mag-aral ka ng ortho. Paaralin kita ng ortho. Ako magiging professor mo. Lahat ng mga materials, kunin mo dito sa clinic. You can practice with all the patients that I have. And after you're done with this, yung hinihingi mong amount na dagdag sa salary mo will be more than that. Even if you work, even if mag-resign ka na sa akin, you'll be earning more than what you're asking me.
Wow.
So, nag-isip ako, sabi ko sa kanya, tomorrow I'll come back, Doc, and talk to you about this. Kinabukasan, sabi ko, sige, Doc, tatanggapin ko yung offer mo. So, nag-aral ako ng ortho. He was my mentor, professor. He taught me everything. And during the time na nag-resign na ako, because I have to work in Pampanga to cover for my wife because she's already pregnant during that time, I started receiving some calls from other dentists who are asking, you were referred to me by Dr. Bayani, and he said that you can provide orthodontic treatment for my patients. If it's okay with you, you come here every Sunday, ikaw mag-handle ng mga ortho cases. So, naging ganun ang ano ko noon, ang takbo ng trabaho. Monday to Friday sa Florida Blanca, Saturday, I go sa Angeles. Sunday, I go to Baliwag. So, 7 days a week.
Grabe, busy. Tsaka ang laki talaga ng influence ng family at tsaka ng support around you na naka-receive po kayo ng ganung klaseng support, and then may nag-recommend din po sa inyo, and then somehow, many years later, nakikita naman po that you've given back so much because you're also giving back to the community. Somebody gave it to you and you passed it forward.
Actually, it's like paying forward na lang.
Yes, yes.
The support that they gave you, you have no other means to give it back to them because they're already well established. You have to pay it forward for those who are not able to, provide or have, dental treatment for themselves. So parang naging ganun na lang. Tinulungan nila ako para makuha to achieve this course. In some way, you have to give it back to the community. Actually, tinuturo yan sa dentistry. Yung tinatawag na you have your duty to the profession and you also have your duty to the community. So, as part of that, you're actually giving back to the community of what you received as well.
Yeah. Really nice. Thank you po. Very, very inspiring. And I'm so glad that 3 of you are here tonight. And actually, Miss Carla, I have a specific question for you because I'm really wondering, what is the difference between a nutritionist and a dietitian?
Okay. So, good thing na tinanong mo yan. And I'd like, at least for clarification na rin. So, there is this saying that everybody can be a nutritionist, but not everyone a dietitian. So because the difference is in the education, training, and of course professional accreditation. When you say dietitian, it is someone na nakapagtapos, nakakuha ng bachelor's degree of nutrition and dietetics or any similar title, and who took a licensure exam. So we are also a licensed professional, and of course being a licensed professional and professionals, so nandun yung namin commitment to the practice. We are so continuing education is a must kasi it's food and technology, so kailangan we always have to be updated. But because we are dealing with food, and food is heavily tied with culture with everyone. Everyone eats, everyone needs food, everyone has control sa kinakain. I mean, something personal and scientific at the same time. That's why everybody has an opinion to it. Food, na hindi mo naman pipigilan eh. It's not saying na you don't take an advice from a nutritionist. Everybody can give advice, but the difference lies with yung credibility bias. It's something updated, and we want to avoid misinformation. It could be kasi information can be interpreted differently by everybody. But being dietitian, we studied for it. We update ourselves. We use evidence-based practices and information. So, doon po nakakaiba.
Okay, and because you're here today, I would really like to ask you, because a lot of people have told me, especially non-Filipino friends, have said that they find that Filipino cuisine or Filipino food is not healthy, the way that we cook it. What would be your suggestion, or what would you suggest to your patients to make Filipino cuisine more healthy?
Yes, personally, I've also received a comment like that na they have this impression na yung Filipino cuisine tend to be more high in sodium.
And we put a lot of sugar, that's part of our recipes, oily. So how can we kind of tweak that? And what's your take on that po? Sa mga, kasi sabi mo nga mahilig kayo sa food, and foodie kayo, and also coming from your father. Yeah,
it is true. But it's not saying that it's bad, because food can also provide comfort, bond, and it's heavily tied sa culture natin. So, but it doesn't mean na we have to eat it every day, like yung mga ganong ka-indulgent na Filipino food items. But if we say, for example, we can control if we cook the food. One specific example is adobo. We have adobo sa puti.
Adobo sa gata.
Ayun. Which,
mas healthy yun kaysa sa soy version.
Yung adobo sa puti is removing the soy sauce. Yun. So at least andun pa rin yung asim. And we have different kinds of adobo. We have meat adobo. We have so instead of kung talagang if you're craving for adobo, hindi naman kailangan yan palagi ang meat. We have a lot of versions of adobo, like adobong sitaw, adobong kangkong, adobong eggplant. So instead of using meat every day, you can substitute it with vegetables. We also have pinakbet. We also have a lot of yung mga sinigang.
Yes.
Yung mga ganyan. We can control the things that we add. Kaya it's always advisable na the more we know how it's cooked, how much is added, kung ano yun. And and also pag sa yung kare-kare, we have vegetable kare-kare. We have a lot of a lot of things that we can do with our cuisine if we all just want to satisfy yung taste,
and craving. You know, I actually took a course. We had one class, I remember, at university, and it's one of the most influential classes I took. It was a class on nutrition. My course was completely different, and I will never forget what they said. And please tell me if this is true, that actually the body doesn't need to consume that much meat. That the amount of meat, and they compared it to a Knorr cube, is actually just 2 pieces of a Knorr cube is what amount of meat you need in a day. Is that true?
There's some. Not really, but
okay.
I get.
Maybe I remembered wrong from my course, but
I get the 2 serving,
yes,
2 Knorr cubes. In fact, 1 serving of meat is around this much. So
like the palm of your hand.
Yeah, true. So
that's all you need in one day?
No, that's 1 serving of meat.
Serving. Okay.
One serving. So normally under normal I think around mga 5 to 6 servings a day.
Okay.
But it doesn't have to be meat as a source of protein. We do have a lot of sources of protein. Meat, red meat, we have fish, chicken, we have egg. We have plant-based sources of proteins, legumes, beans. na hindi naman kailangan palagi ang meat kasi we have to be mindful about the cholesterol naman.
Yes, yes, true. You mentioned this about plant-based. Actually, it's quite a fad. Ang daming mga diet fads, and one of them is also, I wouldn't say it's a fad, but a lifestyle now, a vegan lifestyle, or also intermittent fasting, like all these different diet fads for people who want to lose weight. And I think that's one of the topics we're in. I mean, in Filipino gatherings, it's funny because we love to eat, but we also love to talk about how we're gonna lose the weight and the food that we ate. So, what is your perspective po on these diet trends, and how do you promote what is more a more sustainable weight management and not this instant kind of losing of weight that is, I don't know if it's healthy for the body. So ano po yung what would you promote po for sustainable weight loss?
I think it's normal for a person to gravitate or to gravitate towards instant results. Gusto natin instant eh. So kapag nakita natin na pumayat siya ng ganito kabilis, parang gusto rin natin. Pero we tend to forget yung long-term effect. So I'll go back to that. So yun nga, ganun eh, gusto natin yung instant. Of course, you will lose weight because you tend to umit. Yung talagang pag kumain ka ng konti, talagang papayat ka. Question would be, ano yung magiging long-term health effect nito sa'yo? And is it something, you can ask yourself if you're gonna do this fad diet, is it something that I can do in 5 years, 10 years? Talaga bang magagawa ko to? Kasi yun nga yung question of sustainability.
So what can we do for this sustained weight loss? Like what are some major changes that we can make in our lifestyle? Also taking into consideration yung culture natin.
What we do, i-review mo muna yung yung diet habits mo, ano ba yung eating habits mo, ano ba yung lifestyle mo, and what can you tweak, or paano yung babaguhin mo, pwede mong baguhin doon, kasi it has to be, for it to be sustainable, it has to be something na you can do every day. It should be realistic. So yan, if you find yourself for example, kumakain ka lang na once or twice a day, is it hindi siya tama eh, kasi 1 or 2 or ano ba yung mga foods na available ba sa pantry mo, is it something na healthy, or baka naman puro chips or yung mga ganun na things na you can tweak mga paunti-unti. And of course, nandito naman kami mga R&D sa mga dietitians that you can ask. And to mention din yung mga fad diets, wala pa silang studies wala pa silang yung mga conclusive na results, yung talagang sabihin na safe ito. Yun. So, yan lang. Sustainable, kailangan mo lang din talaga ng patience kasi hindi siya overnight. But the results are rewarding. It's hindi kayong papayat din kapag you will gain and more. Yeah.
Do you have patients do you have any story of a patient who really changed their health, not just about weight loss, but changed their health, like maybe they had diabetes or hypertension and changed it because of a change in diet or nutrition? Do you have any story or example that it can really drastically change the state of the health?
Yeah. So yung day-to-day work ko is I'm dealing with inpatients yung naka-confine sa hospital. So and acute setting, ibig sabihin they don't stay there for that long, really. So kung ano yung problema nila, we attend to it, like sa as a dietitian working in an inpatient acute setting, yung kapag fed yung patient and nag-i-improve siya, kumakain na siya, yun yung rewarding. But I'd like to mention na yung End Up Qatar, yung organization has recently did a collaborative program with PICPA, mga accountants, yung The Biggest Loser. That was concluded last July. It went on for mga 3 to 4 months. So we had 5 participants na accountants. Then yung mga mentors was from us, dietitians. And yun nga, after 3 to 4 months na nakakita talaga ng significant improvement, not only sa weight nila, hindi lang, of course, mas okay din na nag-lose ng weight sila, pero more importantly, na-instill namin sa kanila na hindi lang, it's not all about losing weight, it should be dapat may nabago sa dietary habits mo. And of course, hanggang ngayon, kahit nag-conclude yung program, we always yung open communication between the mentors, mentees, yun yung siguro rewarding part sa amin as dietitians.
And ano po yung one piece of advice that you could give with regards to yung what you feel is kind of like an overlooked aspect of our nutrition that you could give to our viewers tonight?
Yeah, I think hindi naman tayo salat sa information with regards to diet, nutrition. But I feel that this is something na we take for granted. We always say we are busy, we cannot, but do we really give priority sa ating diet? It's something na, yun nga, kasi hindi natin nabibigyan ng much priority and importance. And dahil sa kabisihan natin, minsan we tend to look for mga quick fixes or kung ano yung mabibili natin, yun na yung iyaana natin. So, overlook, yes, we really need to prioritize our diet or eating habits. Yon, and
guilty na ako dyan. Kailangan
it takes
so no quick fixes for
it
sure.
It takes knowing your eating habits first, and knowing that na meron po tayo mga registered nutritionist, dietitians that you can consult and ask. Lalo na sa era of dami ng information around. So food is, it has a direct effect sa health mo talaga. So it's something that should not be taken that lightly. Kasi nga, ang one of the top risk of diseases like diabetes, hypertension are eating habits.
Oh my gosh, yes.
But we tend to, I know, alam niyo naman na we take that for granted.
So let's not take that for granted.
Yes.
Know yourself.
Yes.
Know yourself and consult. I love that. Thank you so much. I actually wanted to ask Dr. Barrera, Dr. De La Cruz, what are some of the misconceptions or rather maybe even practices in our culture that you would like to really warn our fellow Filipinos against? So, lalo na when it comes to the oral health, the oral hygiene.
There's a lot of misconceptions like mga kababayan natin, pag wala silang nararamdaman, okay lang. So, important po talaga yung regular check-up at least kahit once a year. So, kailangan nagpapalinis kayo, prophylaxis, everything. So, from there, na-check up, nakikita na habang nalilinisan na kayo, nakikita ng dentista yun, kung regular kayo, hindi lalala. So, prevention, dapat lagi yan number one sa inyo. And then, ano pa bang mga misconception that when gums are bleeding, okay lang, no? Kailangan
especially when brushing the teeth, right?
Tapos sobra kang yung kala mo mas malinis pag the more yung pores, at mas maputi ang ngipin, mas healthy. And yun nga, parang lalo pag like yung akala rin natin sugar causes cavities, which is ang totoo talaga is yung bacteria. Kaya nga lagi, lalo mga bata, bedtime, at least diba morning and bedtime, brush your teeth because pag natulog ka, dun yung accumulation ng bacteria. So pagising mo, naka-form na siya. And then additional, Doc?
Yeah, isa sa mga misconception nila na when they say oral health lang yan, it doesn't affect your body. Which is, that's definitely not true. Because a lot of people who have oral health problems sometimes could affect their cardiovascular system. Lalong-lalo na if there's an infected tooth, no? That infection could go through the bloodstream and could further affect your heart. Magkakaroon ka ng cardiovascular diseases. So once a tooth is infected, lalo na it has access to your body through the nerves, through that gives nourishment to it, no, yung blood streams niya. It could go through, lalo na kapag yung pasyente is very prone sa meron ng existing history of cardiovascular disease. So it could affect your
Or
body.
also in the family, if it runs in the family as well. Okay.
So again, isa pa sa mga misconception nila, sinasabi nila, pag mas maputi yung ngipin mo, mas maganda yan. Actually, the color of our teeth is dependent on our complexion.
Really?
Yes.
Oh wow.
Meron
I feel like my mind is blown tonight.
Yeah. Meron mga pasyente nagsasabi, gusto ko doc yung maputing-maputi.
Yes,
But
people even go for whitening procedures. It's a whole thing in the beauty industry.
Little do they know the color of your teeth should match your complexion. Meron nga sa atin, there's an area, mostly in Cavite. Kung mapapansin mo, majority, many of the people living in Cavite have white teeth.
Okay.
Which, isipin mo, ang ganda ng ngipin niya, puting-puti. Pero, actually, they have this condition na tinatawag natin fluorosis. So, there's a large amount of fluoride content in the water. So, kung makikita mo, ang ganda ng ngipin mo, puting-puti, pero that doesn't mean it's healthy. That patient could possibly have fluorosis, generalized fluorosis. So, ang advice namin, yung mga gustong magpaputi ng ngipin, usually, I tell them, pwede natin paputiin yan 1 or 2 shades lighter. Pero to make it totally maputi in comparison to their complexion, parang awkward naman.
May additional lang ako. Important.
Yes, and if you can
Naisip ko ngayon lang. Kasi di ba parang gusto-gusto natin sinatawag na Hollywood smile, yung nagpapagawa ng veneer. Ito from my point of view as a ortho and general dentist, more of conservative types. Kasi, di ba pag binawasan nyo na yung mga enamel, ganyan, hindi nyo alam yung after that procedure, yung maintenance dyan, expensive. So, kaya nyo ba? May mga may time 5 years kailangan palitan. Pangalawa, before kayo siyempre kikita ka. Kasi nga sabi ko nga sa inyo, hindi nga ako payaman eh. Kasi sasabihin ko agad, kailangan ko munang yung procedure like cleaning, and then after that yung i-restore mo yung mga dapat i-restore, mga pasta, and then ortho. So, yung alignment, everything, normal yung So, bakit mas gustong-gusto nila yon? Ang dami ko nakikitang artista, pasensya na ha. Maganda sila akala nila maganda, hindi. Tapos yung color, hindi nagmamatch. Tapos halatang halata. So, dapat aesthetically, cosmetics. Yung maganda siya.
And also yung maintenance, as you said, because with veneers, they remove a lot of the teeth in order to put those veneers, right? So, that's quite the procedure, and it's quite painful. But one of the reasons why we remove a little bit of the teeth is because of tooth decay, right?
Yeah.
And a lot of kids right now, parents with children, what advice would you give for preventing cavities? And I actually have a follow-up to that, because I heard that cavities or children are less prone to tooth decay if they are not exposed to the saliva of adults that have cavities. How can we prevent children from having tooth decay? And is that true? Like, the transmittance of saliva through sharing spoons, sharing drinks, like also through kissing our babies, like, is that something that you can really transmit?
Yeah, actually it's true, no? We have this bacteria we call Streptococcus mutans. Ito yung mga bacteria.
Sounds scary. Streptococcus mutans.
They are the just imagine they are the sugar loving bacteria.
Okay.
So when you kiss your kid or any of your family member, this bacteria can be transmitted through your bodily fluid. And then it could be carried by your saliva and you can pass it on to your kid. So parang sinabi mo, binigyan mo siya ng bacteria, and this sugar-loving bacteria will stay there in his mouth or in her oral cavity, and as soon as she consumes sweets, no, this could be
like activated.
Yes. So the cavity or caries tinatawag natin is not generally caused by sugar, but the bacteria that feeds on it,
which can be transmitted.
So for prevention, ako kasi personally sa aking mga anak, may ginagamit ako na tooth mousse. This tooth mousse can initiate enamel regeneration. So this has been proven in Australia. They already conducted these studies na during an early phase ng enamel degeneration, this can help by replenishing the lost enamel structure dun sa bata. So it's like saying na you're adding something to initiate enamel growth dun sa ngipin nung bata. And I've been using this tooth mousse for almost since my kids started brushing their teeth. Ang ginagawa ko kasi after ko sila sipilyuhan, I will topically apply this. Ipapahid ko lang a pea size, tapos I will rub it against the surfaces of their teeth and let it stay there.
Okay.
And it will be absorbed by the enamel inside her cavity. So doing this every day, it's like putting additional protection to the surface of the enamel of your kids' teeth.
And is this available here?
Here I could see some, no, but yung sa akin kasi, whenever I ask my godmother there sa Pilipinas, I will let her order for me and she'll send it here.
So available siya sa Philippines?
Available siya sa Philippines. So there's a particular distributor for that tooth mousse. So I usually coordinated with her na tita, pwede magpabili ulit ng mga 4 na kahon, papadala. Kasi every year, my eldest daughter comes here for vacation. So siya na nagdadala.
What's the ingredient of this tooth mousse that really makes it, is it xylitol?
No, it's composed of a special fluoride mixture. Pero compared sa regular fluoride, it has more components that would initiate further enamel regeneration.
I feel like you've busted a lot of myths this evening with regards to like oral hygiene and health, and also like diet and nutrition. And I really wish that we had more time because and I'm hoping that we can invite you back maybe for a one-on-one to speak more about specific things that we can share with our kabayans, because you really have such a wealth of knowledge that is so helpful. And thank you for being here tonight. And before you go, I would like to invite you to maybe greet or shout out sa mga pamilya, mga friends dyan na nanonood ngayong gabi.
Yes. Kanina kasi bago ako umalis, nung nagpaalam na ako, sabi ko doon sa anak ko, alis na si Daddy. Daddy, who's going to play with me? So para makabawi. Hi Jade, hi Clark, and also I would like to greet my wife. And also yung mga kasamahan ko sa Qatar University, si Rina, si Riza, si Romelin, si sino pa ba? Si yung isang nakabakasyon. Si Rina, si Romelin, si Riza, si Flor, yon. Hello sa inyong lahat. And also sa aking mga kaibigan at kapamilya na nasa Pilipinas, sabi ko sa kanila, you can watch me on your Facebook page.
Yes, ako naman, of course, salamat sa Diyos, syempre, and ang aking pamilya, especially si husband, nandyan kasama PPOQ, and of course the Filipino Dentist Organization in Qatar, and ini-invite ko po lahat po ng dentista, lahat po ng DMD, Pinoy DMD dito sa Qatar, na sana po mag-join po kayo, especially po yung mga practicing licensed dentist po rito. And then yung kahit wala pong license, kasi hindi naman po kailangang may license para maka-join sa Filipino dentist, and who knows, through us makapasa kayo at magkaroon kayo ng license. Yeah, and then
also helping PRC.
yeah, SPLE.
SPLE. Yeah, for how many years?
Can you ano yun? SPLE.
SPLE is a special professional licensure examination being conducted by the PRC. May delegate sa kanila na pumupunta dito to conduct the licensure examination. Sa dentistry kasi we have two parts, the theoretical and the practical. Before, we are helping them do the theoretical part here, and once they pass the theoretical part, they will do the practical sa Pilipinas na. So, along with the other professionals, we are conducting this SPLE yearly. So every professional organization here, including NDAP, nursing, most of the healthcare professional organization, we are part of this SPLE here in Qatar.
Bilisan ko lang po, ayan, sinabi na po ni Chairman yung sa PRC, yung mga board exam SPLE. And then, thank you so much po sa almost 19 years ko sa lahat ng mga napasokan ko, yung Al-Ali Hospital, Medina Dental Center, PHCC, so ano pa ba, Magrapi, ang dami, di ba? Dahil yan lahat, dahil kaya nagkaroon ako ng award. And then, Qatar University's College of Medicine, Nursing, and Pharmacy. Wow, jack of all trades na. And then UDST para medicine, RT, and nursing, and what else? Doha College also, kasi nag-proctor din ako doon. So, nagpa-proctor din ako sa Cornell for the National Board of Medical. So, parang doon na linya naman ako. And then, nakakahiyaman, banggitin ko na rin po, yung aking pong second album, workout ko na po, matatapos na. Pero yung first...
Station, no problem. You can mention your
yung first album po, tapos na po, all original song 7 with under Benny Saturno Music Corporation. And my second album po ay under Direct Mel Magno Film. So, dun sa kanya naman po nakafocus ang mga movies and everything. And natapos ko na po yung mga music videos. So,
I love it. Thank you.
Thank you.
Hi, una sa lahat yung family loved ones ko na nanonood sa Philippines. Kung gising pa kayo, hi pa, Jamie, yan, hi sa inyo. And my friends here and in the Philippines, of course, my colleagues, Nutritionist Dietitian Association of the Philippines Qatar chapter. Hello sa inyo, sa mga nanonood. And ayoko sanang may mamiss. Basta hi sa inyo lahat na nakakilala. And thank you for taking time to watch.
Ay, additional pala, nakalimutan ko batiin yung panganay ko na nasa Pilipinas. Actually, she's taking up what you call this medtech. And I'm actually coordinating with Pressmail. Sabi ko sa kanya, Pressmail, pag may mga mahirap na tanong yung anak ko, ifo-forward ko sa iyo. Ikaw ang coach niya. So, CJ, pagbutihin mo, and hopefully everything will turn out well. She's planning to take medicine in the future kasi.
Oh, that's amazing. Thank you po.
Isa na lang po. Mama, thank you so much. Parents, Papa, wala na siya, pero si Mama, malakas pa rin. Salamat. Hindi ako nagsisisi na ipinilit mo ako maging dentista. But somehow, nagawa ko pa rin yung passion ko na kahit matanda na age, it's just a number.
Yes, I totally believe that. And so, thank you so much for joining me here tonight on this episode of Usapang Qabayan. Thank you actually for giving your time on this Saturday evening to be an inspiration to our community. It's been a privilege for me to share, to be able to listen to you share your knowledge and expertise in your profession, in your advocacies, in your passion and theater and singing. And again, congratulations for being recipients and recognized as the top healthcare professionals in the Middle East Awards 2024. Thank you so much. On Usapang Qabayan, it is our aim to elevate the voices in our community and to bring you knowledge and inspiration as you navigate your lives as Filipinos working in the Middle East and around the world. This is Tasha, and it has been a pleasure being your host for this episode of Usapang Qabayan. Thank you for joining us. It is a privilege to be a part of your day. Thank you and good night.
Thank you.
Thank you. Salamat.
Usapang Kabayan. Usapang Kabayan. Bibigyang linaw ang mga usaping nagbibigay ng interes sa mga kababayan. Sasagutin ang mga katanungan tungkol sa mga isyong may kinalaman sa mga overseas Filipinos. Magbibigay ng mga impormasyon at kaalaman para sa mga mamamayan. Ito ang Usapang Kabayan. Usapang Kabayan. Sabayang mapapakinggan sa radyo at mapapanood live online. Dito lang sa Qabayan Radio 94.3 FM.
The legends are coming. Get ready for the most anticipated reunion of the year. For decades, their music has defined a generation. Now, the legends return to take you on a journey through sound, emotion, and memories. Eraserheads World Tour 2024. Huling El Bimbo live in Doha.
Live in Doha.
Feel the magic of the Eraserheads live for one unforgettable night.